Hello, good afternoon. I'm back again. Just a bit of a space between patients this afternoon in my clinic, so I thought I'd give you all a bit of an update. So it's a question I get asked quite often in my clinic. It's about meniscal tears or cartilage tears, and really the main question I get asked is, do I need surgery for the tear? So really, to answer that, this is a good question, because lots of people will have scans or be diagnosed with a cartilage tear, but not all of them will need surgery. So the first question that I often get asked is, will the tear heal on its own? Well, quite often the tears don't heal on their own, but the symptoms that the tears produce will subside, will get easier, so the pain, the inflammation may well settle. And with the smaller tears that aren't catching or causing the knee to lock or give way, then it's perfectly reasonable to give them time to settle. You can take anti-inflammatories, ice, maybe a course of physiotherapy can help. So first stage would be, if it's not causing you too much bother, maybe have a pause, think about things and just let it settle. If you're having persistent symptoms and things aren't settling, then sometimes a cortisone injection can help. And that's not healing the tear, it's not getting the tear to knit back together again, but it's reducing or dampening down the inflammation in the joint, which helps improve the symptoms. And again, that will allow you to get more active again, get back into exercise, and then that will have, hopefully get things to settle down for you. For some people, that's all they require, particularly if a lot of their symptoms are pain rather than the mechanical sort of giving way or catching symptoms, and particularly if perhaps they have some underlying arthritis in the joint. So the other question we get asked is, well, can you repair the cartilage? And probably the easy answer is yes, you can in some cases, but not in all. Most cases, it's torn in such a way that you can't really repair it. The cartilage, the tissue, might not be suitable to take a stitch. It may be very friable and quite soft, so the stitch will just cut out and the cartilage won't heal. But in younger people, patients under the age of 40, 45 say, who are quite active, who are non-smokers, if the tear is around the outer edge of the cartilage where there's a good blood supply and the cartilage tissue that's left behind is in good condition, then they're the type of tears that can be repaired. And we usually do this by stitching it back together again and then protecting your knee in a brace and with crutches, keeping the weight off it for 6 to 8 weeks afterwards. But for most tears, we just trim out the torn bit, and that involves a keyhole surgery. And the analogy, really, a bit like having a broken nail. It's catching all the time. You just trim the nail so it smooths it off so it doesn't catch anymore. And that's the sort of thing that you're doing inside the knee to the cartilage tear. So how do you determine whether the symptoms that you're having, whether you need a cartilage tear or not, whether you need surgery or not? So I suppose the main symptoms that we look out for as surgeons would be what we call mechanical symptoms. So we class them as giving way, so the knee feeling unstable and unsteady, causing you to stumble or fall. Locking, so the knee physically not being able to straight, something blocking the knee, usually the fragment of the tear gets in the way, a bit like a doorstop, stopping the door opening. And that can be intermittent. It can happen, patients will maneuver their knees and it unlocks, but if that's happening regularly, that's certainly something that would benefit from surgery. And then some more subtle signs of catching or sharp pains in specific points around the joint line, aggravated by certain activities, certain positions, with the rest of the joint being essentially in good condition. Then again, these are the type of cartilage tears that may be amenable to getting a good result following surgery. So hopefully that answers the questions. Not all cartilage tears need surgery. Help you decide whether it's right for you. Give it a time to settle. Maybe try other treatments first. If it doesn't settle, then consider surgery. But as always, it's probably best to get advice from a knee specialist earlier, sooner rather than later, because that will help you understand the diagnosis, help you understand your treatment options, and help you make an informed choice about what's the right treatment for you. I hope this has helped. If it has, please share it with your friends or people that you know that may benefit from this information. And as always, if you want to get in touch, you can go through my website at mynedoc.co.uk, or you can call, leave a message. We'll get back to you on 0161 464 6399.